going to talk about just what is naturopathic medicine and how are we different as physicians. And one of the main reasons is, if you can see over there to the left, we're addressing the underlying cause, as opposed to what most people are used to in just the suppression of symptoms. Because when you have fatigue, weight gain, depression, anxiety, GI problems, pain, loss of mobility, ADHD, and insomnia, a lot of the things she talks about that these teas, botanicals, are good for, that is a symptom of a deeper problem. And what we're trying to address, and what I'll talk about tonight in between talking about the botanicals and teas, is some of the testing that can be done to find the causes. The underlying cause, whether that's elevated blood sugar, vitamin D deficiency, low omega-3 fatty acids, a CoQ10 deficiency, poor posture, structural breakdown, gluten sensitivity, GI infections, toxins, medications, and nutritional deficiencies. What happens is those underlying causes, that leads to physiological damage in the body, especially at the cellular level, whether that's inflammation, oxidative stress, mitochondrial dysfunction. And that then affects our body systems, whether that's the heart, the adrenal glands, the joints, the thyroid, the GI, the immune system, the brain, the liver. And that manifests in different people in different ways. Brain fog, skin problems, autoimmune allergies, all symptoms of the bigger problem. And again, that's what we do as naturopathic physicians. We're always looking at what's the underlying cause. We don't want to suppress symptoms. Everybody's suppressing symptoms. We want to get to the underlying cause. She talked about some of the botanicals that are great, the nervines for stress, anxiety, depression. Those lead to chronic fatigue. We will do lab testing, a simple urine test, and that can identify nutritional deficiencies, toxic elements, oxidative stress. That answers the question, why? Why are you anxious? Why are you depressed? Why can't you sleep? Why are you so stressed out? Why do you have chronic fatigue? And here's a printout of that. I'll pass this around here. Just take one and pass it around. What you're going to see on there is what this addresses. So the fats and the carbohydrates that we eat in food, it'll show us if certain metabolites are elevated, are we utilizing that for energy? The fats and the carbohydrates you eat, you utilize those for energy. There's also markers on there that'll show us how your body is producing energy. So if certain metabolites are elevated, that'll show us that you need support at the level of energy production. Methylation, if anybody's here to talk about methylation, it'll tell us about that. And then neurotransmitter metabolism markers, and that's kind of what I'm going to focus on with what she just talked about, with the botanicals, with the nervines, lowering the stress, lowering anxiety and depression. When you'll see on there those neurotransmitter metabolism markers, if certain things are elevated or if they become very low, we know specifically where a patient needs support. Even detoxification indicators, she talked about the dandelion, the burdock, that's great for detoxification. That can show us specifically if somebody needs support, if their detoxification pathways in their liver, specifically their phase 1 and phase 2, do they need support there? So this really individualizes it for us, where to focus, what somebody needs the most. It can also show us if they have yeast, fungal overgrowth, and certain levels of bacteria. A case that I just recently had running this panel was a 37-year-old female, and she had 22 years of extreme fatigue. Ran this panel, and that's what the next one is here, and you have that as well. When you see those markers on there, under the neurotransmitter metabolism markers, you'll see that markers that were very low, those are for your catecholamines secreted from your adrenal gland, your epinephrine, your norepinephrine. Your epinephrine's also known as adrenaline. Everybody's probably heard of adrenaline. When you need to, somebody lifts up a car off of somebody's leg, that's their adrenaline kicking in to get a lot of strength. Well, in this patient, you can see on there that it was very low. So we knew exactly where this patient was deficient and exactly where they needed to be supported. The one below that, the 5-hydroxyindoacetate, you probably heard of serotonin. A lot of people are on SSRIs for depression because we're trying to increase the levels of serotonin. It doesn't really increase the levels of serotonin, it just re-inhibits its uptake. But if you don't have enough serotonin to begin with, it doesn't do a whole lot to support the patient. And you can see in that patient that was high. So that meant there was a high turnover of serotonin. So again, knew exactly where to support that patient. And what I had here, 1 week later, after depleting those deficiencies, after 22 years of extreme fatigue, we've seen that fatigue almost virtually eliminated from specifically supporting them where they needed it, and the stress was greatly reduced.
Can I ask a question?
Sure.
Supporting them with herbal supplements or
Nutraceutical formulations, yeah.
nutraceutical formulations?
Yep. That included some of those, the nervines that she'll talk about, that she did talk about. But specifically for, like if those, in this patient, they were very low. The catecholamines are very low. So they needed the amino acids to produce more catecholamines. But if they're high, that can be from chronic stress. If they're elevated, there's a high turnover. So we wouldn't necessarily give the building blocks to make more, but some of the nervines and chemical she was talking about, we'll give those to balance out the adrenal glands, that calm down those catecholamines. And yes, so to answer your question, yes, those nervines, those botanicals, to calm down the catecholamines at the level of the adrenal gland. But her support was making more of them. So again, that's going to guide us with treatment as well. If they're very low, then they need the building blocks. If they're really high, they need the adaptogenic